Good Friday morning or afternoon or whatever time it is from where you are joining us. Thank you so much for being here. We're just going to let people get into the Zoom room here and then we'll get started. Okay, I know we're just going to do some intros to start, so I feel like we can do this here. So today we are going to be talking about sex intimacy and sensuality as relates to serious and chronic illness and disability. And today, as our co-hosts, we have two of the fabulous mental health counselors. We have Ladybird Morgan and Claritza Rios, who are going to be leading us through these slides. Thank you both so much for being here. Ladybird, if you want to go ahead to the next one, I will just give everyone a rundown. So after Ladybird and Claritza go through these slides, you'll have a chance to interact with them and ask questions. And you can do this in a couple of ways. You can click on the raise hand button and we will unmute you and you can ask your question out loud. Or if you prefer not to do that, you can type it into the Q&A section and I will read it out loud for you. So again, you can raise your hand and speak with Claritza and Ladybird, or you can type it into the Q&A if you'd prefer to just have me read it for you. Important note about these, they are meant to be a very safe space. So if you want to remain anonymous, please just let me know. We are happy to address any questions that come up and want it to feel as good and safe for you as possible. Thank you so much for being here. The other thing you can do is just kind of check in the chat if you'd like, just to say what might be resonating with you or ask a question as well. We also monitor that part. So thank you again for being here, and I will pass it over to Ladybird and Claritza to get us started.
Thank you. Thank you. It's lovely to be here this morning and to have this time with you, Claritza. Thank you for sharing this space. And yeah, we're going to talk about sex, sexuality, and intimacy, which doesn't get talked about a lot in these spaces. So we thought it would be helpful to open the conversation with what I feel like is one of the goals of intimacy and sexuality is connecting, and something that we struggle with when our bodies change, when something happens in our bodies with illness, in our partner's bodies. The landscape shifts around how we know how to connect with ourselves and how we know how to connect to others. There's a lot of uneven territory in there and places that sometimes usually don't get light shown on them due to a lot of baggage, a lot of stories that we have, and at least in the American culture. Other cultures have their own stories and baggage that gets glommed on there around what we can and can't do, what's appropriate, not appropriate, what we should be embarrassed about or ashamed of, versus just what is innately in our bodies as human beings to experience and explore. So it's a rich conversation. It can be tender. It can feel uncomfortable. It can feel really exciting. And I just want to say again to what Sonia pointed out, that this is really, we want to be as a courageous space as possible for you. So that doesn't always feel safe, but courageous to me feels like a place where you can at least push some edges and know that we are holding your words with a lot of love and confidentiality, for sure. Claritza.
Yeah, and I just would add that connection means different things to different people, as Ladybird alluded to. And so as you're thinking, we're talking examples or people are sharing in the chat, just keep in mind that it may not be exactly the same for you. And as Ladybird said, really important to just be aware that a lot of the things we talk about in these webinars really are prickly. And so they'll elicit a lot of emotion in you, or things that you didn't really think were there. And so it's important to really honor that and at your own pace and in your own time.
Yeah, these are definitely suggestions and thoughts. Neither of us are experts or telling you how it should be or what it should be. We're just having a conversation. So I want to make sure that that's clear.
I love that. Yeah. And so I think one of the things that certainly in our society comes up when we're dealing with chronic illness or disease, um, is that, or conditions that are chronic, is that bodies change. And so I think it's really important to think about, note, reflect on first just your natural relationship with your body, because that really is sort of the anchor, or the rather the cornerstone of how things are built from there, right? So if you have a relationship with your body that is centered around movement, action, strength, aesthetics, and a chronic illness may be part of that story, like along the way, it is important to kind of know where your relationship, where it starts, so then you can um, talk to yourself, get help, process, grieve, whatever changes come along the way, as your body changes or ages or there's some decline. Thoughts on that, Ladybird?
Yeah, no, I think that's, I mean, our relationship, our initial relationship with our own bodies, it's easy to say that you should have that, but I would say, like, I don't have a particularly amazing relationship with my body. And if in this moment, all of a sudden something were to happen to change my capacity, I would feel quite bereft. I would feel like I missed out, or I thought I was going to get to something later. I thought I was going to get to self-compassion or loving myself, and I didn't get around to it. And now all of a sudden I'm in a position where I feel even farther away from that capacity. So having a relationship with your body is it's an ongoing dynamic that changes. And when you have an illness, it really invites that possibility of being tender with yourself, I guess, is the first place of recognizing, like, this is what's happening in my body. This is who I was before this was happening, and sort of making friends with that space to bring that a little bit closer, so that moving forward, you are moving forward in a body that you can be friendly with initially. And sometimes that involves talking to your medical providers around the choices you're having to make around treatments, surgeries, mastectomies, colostomy bags. There's so many different things that will start to integrate, that can integrate into your life with a little more ease and grace than feeling attacked, chopped at, punished. And so finding a way to make friends with the body that you're in, even if you weren't friends with it before the illness came, is sort of like an introduction to that. And that, again, this is not like easy territory. It's really trippy to say that.
Yeah.
But it's not so easy to feel really great about yourself. And for those of you that do, fantastic, hallelujah. And we would love to have a webinar with you leading the conversation, because it's
Right.
something that could be really talked about. And Claritza, maybe you can speak to what it's been like as a doctor when people come to you with that distress and those concerns, or not feeling connected.
Yeah. One of the interesting things, and you mentioned, and it just got me thinking, is one of the things that we see often is folks having the opportunity to really appreciate what their body does.
Mhm.
And what complicates that is that for many people, it was like, wow, I didn't realize how appreciative I was of the fact that I can walk without pain, or that I could sit up straight. And so there is this opportunity as clinicians for us to allow and create space for people to have grief about that change, and also to explore, as you say, ways in which we can give control, relief, and autonomy. And I think you're bringing up a really good conversation that we'll talk about more, but it's really important that you feel comfortable raising questions about, how do I live my life with this new body condition. And there's a ton of physical therapy, symptom management procedures that we can do to ensure that we can honor your wishes, honor the way you want to be physically. And at the same time, I think it's also important to acknowledge that we have a ton of societal pressure to look, be a certain way, and that, what a lot of patients kind of come to in my experience, and again, I have only been doing this for 20 years, so still have like many more years of learning to do, but is that um, what a lot of people feel this situations can grant them is this ability to kind of define what success, what beauty, what um, what the value that physical activity, physical strength um, is for them in their own body, in their own way. But that's really hard because we're conditioned to be a certain body type, to have a certain weight, to have a certain skin turgor or quality. And so, first, just I think in my mind, realizing that your body perception is complicated and very much has external as well as internal drivers is sort of the first step. That's a lot of words, but I hope it got.
And we're getting like we're sort of laying the groundwork, right, for this conversation about sexuality and intimacy, which is different than our jobs or what we're doing out in the world or how we're responding with our kids or how our capacity to cook or do different things. That territory is a different territory, and so that place of finding a relationship again with yourself, and we'll go to that. I mean, we'll move from this slide because we don't need to stay an hour on one slide.
I know,
but a change
we probably could.
Yeah, we could, but that change in the bodies, I just want to say one more piece about that, which is what it brings open is changing your relationship to the sensual world, right? So how you felt about it before illness might really dramatically change during illness, after illness. I mean, there's different layers of that. So the curiosity to find a new language for yourself, to explore new terrain in your own body with other bodies takes a lot of courage, right? And so the only reason I'm saying that building that relationship with yourself first is helpful is because of the courage that it takes to invite somebody else into that space with you, if that's what you choose to do. So, and the change in roles, it's in some ways it can be obvious, especially if we just with the specific example of partnership. When a partner becomes sick and you become a caregiver, that dynamic really shifts how you respond to each other, how you feel responded to, the levels of what you want to share in intimacy really change because of the exhaustion, because of lack of transparency, or places where you felt like maybe you had more autonomy or wanted to have more autonomy, or maybe didn't want to even go to that level with the person that you love so deeply. All of that gets blurred and mushed, and even that feeling like you have a choice around it out of expectations in relationships and expectations in our roles can really muddy up the water of what it means like to be in partnership and how you want to explore intimacy. So changes in roles is not a small thing. That's just
Yeah. And I think one of the things that's also important to call out about for example, if you're a caregiver or if you are the person who is being cared for, if you're in a relationship, new, old, there is some unhealthy patterns that we all engage in long-term romantic relationships. And we get caught up in this fantasy of like, oh, I'm a caregiver and I'll die for you and I love you and all these things. And that's so wonderful and fantastic. And also as the person receiving that love and care, oh my God, this person, my knight in shining armor, or my wonderful female partner or non-denominational partner, caregiver, lover, how wonderful, how selfless. Yes, those things can exist, but there can be some resentment in there. And it's important to understand that when we get into relationships, the idea we say, especially if we engage in sort of the Western traditional ceremonial approach to relationships in sickness and in health. But in sickness, it's just this idea, right? We don't think about, oh, the mystery is gone because you're bathing me or you're toileting me or you're helping me with these things that don't necessarily feel like your partner should be doing. Add to that the fact that we get into these patterns of unhealthy things we do for each other, we do to each other, based on our trauma and our history. And so it's important to, I think, call out that those things are still there. Those things don't go away because you have this like amazing exchange of caregiving and the person receiving the care. You're still going to be annoy the crap out of each other because he slurps his soup too much, or she does, she Instagrams too much. I don't know. And so, while it's important to call out that there's stress from the illness, there's also the stress from just being in a relationship. And so the role, it's just like compounding on it. So it's all that to say, not to be, oh, the catastrophe, but rather to say that's reality and a ton of opportunity to have grace for yourself and your partner, because now there's another layer that's coming into the conversation. And I just saw there was a little comment in the chat.
Yeah, I can speak to that. Claritza, I was actually going to bring it up too, just about the change
okay,
in
awesome.
roles. And she's saying they both have illnesses or issues that are kind of affecting their libido. But to the change in roles point, she went from being girlfriend to caregiver very quickly, like overnight. And kind of maybe we could speak to that a little bit, that it's not something that's slow going and it kind of ramps up over time, but something where you find yourself fully taking care of someone else in 24 hours.
Yeah, I can speak a little bit to that. We see this often when there's traumatic events that happen, car accidents, falls, things of that nature. And one of the things that often we hear from caregivers is sort of this, I wasn't able to prepare. And so it's been like you're forced to sort of be in this place of caregiving. And so a couple of things that I find a lot of these folks, there's a lot of selflessness that comes when people approach us with these problems, and just a lot of guilt about having ambivalent feelings about all of a sudden becoming a caregiver. I think it's really important to give yourself some grace. This isn't what we imagine when we engage in this like fantasy romantic ideas of what partnering necessarily is. Again, in sickness and in health, it's an idea. And so grace is really important, and also finding ways of, how do, and we'll speak about this more, but how do we create a space of warmth, intimacy, romance where appropriate, and outlets for the caregiver to feel their independence and their ability to kind of disengage from just being a caregiver, especially if it's a 24/7 job. And how do you create community around that so it buttresses you, and so that when you are in a place where you can be intimate, that you can be all in. Ladybird?
Yeah, no, it's really, really important what you're sharing, and the grace. I would just add to that it's not your responsibility to figure out grace. You're being, for lack of a better word, slammed into a situation or feeling like there wasn't a lot of choice, and so
Right.
reaching out for support. So much of why we're here, Mettle Health, is as support for you, and that you don't have to somehow figure this out, become a caregiver, a lover, be intimate, know when to not do it, figure out your libido, get the dinner made, have the doctor's appointments, once the chemo schedule. I mean, there's so much with illness and chronic illness or short term. It's a lot. And the pressures that we put on ourselves to do everything bring home the bacon and fry it up in a pan. I'm thinking of that old song.
Yeah.
It's insanity. It's insanity. And there's also pressure around intimacy and sexuality. And so we'll come to that, because a lot of what's possible is recognizing that things can change, so think you're in a new place, you're in a new stage in your life, and the way that you want to move forward is going to look different. And curiosity, I would say, is probably the most important ingredient in navigating anything, whether it's difficult or not. But the degree that you can find curiosity in yourself about yourself, about the situation, about the other person, that's the seed to focus your attention. The other places of anger and resentment and fear and judgment and all of those things get to be expressed with friends, with loved ones, with a therapist, that you actually get to also have those emotions and feelings, that you're not trying to compartmentalize and only be happy, but that curiosity to get to a next place will guide that movement, if that feels possible. And I think that's a lot of what gets lost too. When you're sick, you're nauseous, you're tired, you're scared, curiosity is like not really it's not there. You're just trying to get through, you're just trying to manage, you're trying to understand how much time you have left. What does this actually mean? What's coming next for you? It can feel overwhelming, and even places of resentment around that you even have to be curious about something, right? But then if we soften back down to being humans in our bodies and recognizing just that simple fact that we are here alive in our bodies, what does it mean? Step away from all the expectations and let that curiosity come from just the place of, I'm still a human, I'm still here, this is how I want to be, this is how I want to connect in the world. Finding that place within your body is an important step, if that makes any sense. I have no idea. So it's so funny to talk to just each other back and forth, because
Yeah.
I need like some feedback from somebody else.
Yeah.
Can I interject something quickly just
Yes,
from that same
please.
person? I just
love
wanted to
that.
bring up this also important point, because I'm assuming this is what many people experience. She's saying that her partner has a very strong sexual drive, but she does not. And I'm assuming that, yeah, that's something that a lot of people bump into. So I don't know if we can address that now about staying in your body, or, kind of touch on it later, but wanted to just do a shout out for that as well.
Well, let's just comment on it now. We can be a little more
Yeah.
jumpy than going with slides. And,
Yeah.
we were going to get to like the
Yeah, that's great.
technicalities of sex and sexuality, but, there are this expectation that your partner needs to fulfill everything for you, that you and your partner need to fulfill everything for each other. That's one story that's out there. And then there are stories where that's not so true, that you can find some curiosity and exploration yourself. And there are notions of surrogacy, where there are professional people out in the world that are actually available to have exploratory conversations around how to be in your body with illness. If a partner is not available, or you're not in that space where you have a partner, there are many people that don't have partners and would still like to have intimacy and these types of interactions. And so being stuck in the model that it needs to just come from a partner is one story that can be looked at a little bit. The other place is to explore conversations around what that actually means. So you deepen your relationship by saying, wow, I don't know that I really want to do that, but let's talk about it. Let's find some other ways that we can be intimate together, and we'll talk about the difference between sensuality, sexuality, being sensuous. There's ways of exploring the sensual world without it being sex. That can really stretch our understanding and our ways of connecting to each other in places of beauty, sharing music, sharing the touch of grass, sharing beautiful food and meals. Those are sensuous experiences that feed our souls. And we start to feed ourselves. We are coming from a different well of nourishment versus a place of lack and emptiness and wanting to get something from someone. So there's a couple different ways to look at it.
Yeah.
Claritza.
I love that. And I think you mentioned, you alluded to this, but just want to call that out again. people get together all the time that have different drives, right? That's just reality. And it can really breed resentment naturally in relationships where it's just a normal, people bring their trauma and you create your cycles and it is what it is. And somehow relationships go on, right? And so I say that to kind of ground us in saying it's not a problem unique to people who are engaging in a relationship with somebody who has a chronic illness. Like anything, if something changes, I think it's really important to allow for grief, right? We no longer have these, morning marathons of lovemaking or whatever it is that you used to do prior to. But I think it's important to first understand how that lands on you, like, oh, we're no longer doing that, or right now there's a pause. Grief, talk about. I can't speak enough to the importance of communication about this stuff. And Ladybird, you mentioned this idea of like how do you engage in intimacy? There's like a million ways in which you can be intimate. And I think you can only find out what your partner is willing to kind of engage in with conversation, respectful, with appropriate boundaries for what can be let in and out of a relationship. But I think there's many ways to fulfill everybody's needs while also honoring where your body is and where their body is. This idea that we need to be in a particular level of energy to be successful in relationships is a story that we tell ourselves. We are at the driver's seat of that. And so I think with communication, you can really figure that out. But I think it's also important to note that there's all this external stuff coming in, a lot of societal pressure on pleasing your partner and creating this like fantasy romance. I think that is unhealthy to subscribe to alone. And I think really staying curious about what other ways can we engage in intimacy and fulfill the needs, I think is sort of the beginning of success. Go ahead. Sorry about that.
And the grief. No, I think I mean, just hearing you say that, it's maybe that's like the curiosity and grief. I don't know. Like I think that we diminish how hard it is, right? And not only grief, but anger. And that's an energy. It's an energetic force in your body. And so to the degree that you can, release it. All right. If that means going and dancing, listening to music, going for a run, boxing, like whatever, getting energy to move through your body. Sexual energy is also energy, right? Emotions are energy. And what we're doing is our experience of all of these energies is shifting in illness, and we don't have a lot of choice about it. And so we start to compress ourselves and feel like we want to stay in the same places that we were. That can cause a lot of challenge. So finding ways to express the frustration and the disappointment and the fear and the loss. And it doesn't always get to be with the partner that you're with, right? We get to find other places to express and to be held, not necessarily intimately, but at least with our emotions, that who we are and what is it happening to us is held by somebody that cares about us. So that means just having tea with someone that you can just say, oh my God, I feel so sad. I don't want to be intimate with my partner and I don't know what to do about it. I feel really bad. I feel guilty. And let there be a way for you to have that feeling, right?
Yeah.
And it's not up to the partner to necessarily fix that for you. You get to find different ways of supporting each other, holding each other in partnership that may look really different than it did before.
Yeah. And I think that you want to find, like, community is really important. So whether it's professional with like a mental counselor or your physician or your therapist, a really good friend, you want to have that sort of escape or like space where you can just say the thing, and in a safe, comfortable, closed way. Also important to engage your partner in, like, how do I show up for you while at the same time stay true to what feels right for me right now. And that's, when you think about it, that's true of every relationship, whether or not there's illness involved, right? We are all very different people. We bring our own stories to the table. And so tapping into the things that help you uh, cohabitate with a partner, right? The compromises that you do about, the way you raise your pets, your children, the way you keep your home, the way you pay bills. There are tools there that you have together, and there's an armamentum that you can bring to this new challenge. Um, but it's so important, as Ladybird said, that you find community where you can just release of all of that stress that comes from the pressures we put on ourselves.
Yeah, and if it's not a person, then nature or pets and animals, right? Like sometimes we don't feel comfortable sharing these things with another human body, and that's not it's not something that's wrong. It's just the way that you are or we are. And so go be in nature, swim in some water, take a hot bath, feel a shower, lay on the grass, go on the sand, like whatever you can do to remember your body. I skipped that, I jumped off that slide, but that's part
Yeah.
of what, staying in your body, that's a little bit what that means, is that, we're responsible for ourselves, and our capacity to show up for the other person is directly related to our capacity to show up for ourselves, right? It's not a judgment, it's not a test, it's just the truth. And so when we're feeling really far away from our own being, we're going to come at somebody from a distance that doesn't actually connect very easily. And then that is going to, you're going to go down a pathway that just feels disconnected and challenging. So to the degree that you can, especially in times of illness and challenge, find ways to slow yourself down and come back to yourself. How am I today? It might be different than how you were yesterday. Yesterday, you might have had a lot of libido and you really wanted to explore some new things. And then you wake up today and you're like, actually, I don't. Actually, I'm in a place of total grief and shame around this. And I feel really different about it. And really allowing yourself to move with the changes that are arising for you. And trusting that you're just being human, that you're finding your way, that you're finding a way to be in your body. And a lot of what we've been saying is, it's been kind of the edgier, harder parts of this, but there's a lot of joy in being sensual. There's a lot of joy in the sexual world. There can be, and there can be a lot of pain for people as well. So it's not that we're discounting that, but we also want to really bring in the absolute pleasure of being in our bodies and sharing that with the world. It doesn't have to be, like we're saying, sexual. It can be sensuous. And that difference of delighting through your senses can really change an experience with illness. I'm thinking about people that are not even getting out of their beds anymore, and to be able to feel a breeze on your skin, a feather on your skin, the smell of something. These are ways that we pull back into the mystery, that we pull back into the sensual qualities of being human. Sexual touch and sensual touch is a relative of that, right? But it's not the outcome necessarily. And so finding a way to get curious about what your body enjoys, not sexually first, just go back to the senses. What do you like to feel? What do you like to smell? What would you like to feel again and smell again, or taste again, or see again? All of these things that we kind of eliminate. And I would say, from a medical perspective, this is something that Claritza and I spoke about in preparing for this, that, we on the medical side do people a great disservice by only tending to an illness. We only tend to you as somebody with an illness, and we negate the rest of your humanness. And so it's up, it's on us to remember the fullness of who you are. It's not up to you to bring that to the clinical team. If you can, and you have the courage and the energy to do that, amazing. They might not respond very well, but to just say that, the system hasn't also inspired that conversation or that exploration. So once illness comes into the story, everything gets whittled down into bits and parts and pieces. And those things are still there. Like Claritza, you said that earlier, like that's all still there. We're still fully human, even as we're losing our capacities. We're still in our human bodies, and there's something to remember in that.
100%. And I think when I think about this slide, it makes me think about, and I'm going back to the communication piece, but it's really important. I think sometimes I've been in situations where a partner of a patient I'm caring for will be hesitant to engage in uh, touch or something where it could have been seen, it could be seen as like sexual or provocative in some way. And when questioned, so why don't you tell him that, you want a massage, or why don't you tell him you want some cuddles or whatever. And there's this like restraint because I don't want to hurt their feelings, that I don't want them to feel unsexy. I don't want them to feel like if they say no, they're gonna make me feel some kind of way. And this is one of many scenarios and instances that I've participated in. And the theme that keeps coming up is this idea that both parties feel um, there's a way, there's a way in which we are this way. And for this particular couple that I'm thinking about, it was um, sexual intercourse in a very particular way was the only way that um, the male partner felt the female partner wanted to engage. And turns out, with communication, as in all these other instances, there's exploration of what, in this particular case, the person had some symptoms that made their start to get them in the mood slow, but they were able to get in the mood. And there were some pain issues that we addressed. And once those were addressed, it was just about getting spicy. And so we talked about what it was that needed to happen. And it all started with a hand massage. There was now a technique, there was a conversation had. And this patient said to me, that because of chemo, touch became like this thing where she had symptoms in which touch hurt, even light touch. As she got through it, he became really hesitant to touching her. And so she wasn't in the mood because they used to be really, really touchy feely. Now that he was able to be touchy feely again, she said, this is the entree into us engaging in intercourse. And which had to be different because of her physical state at the time, but she wanted to engage in that. And it all took a conversation. So all that to say that getting from feeling your world and perceiving your world as a person alone, or with your partner or with your partners, or however that new way of being sensuous, sensual and sexual is, that it starts with a conversation, much like most things that involve two people consenting to something, right? And so just because you have a history of being together for 10 years, 20, 30 years, and just because you think, I know this person inside and out, I ask you, I beg you to engage in a conversation about what each one of these words means to that person and how you move through that, how you can move through that together. Yeah, that's a really windy tangential point.
No, it's really important. I really appreciate that example. Is there I'm looking at I can't see the chat. But it looks like
somebody said that they wish they could put you in their pocket, and I second that. So if you can find little Ladybird
I love living in pockets.
And we can have little recordings of Ladybird.
That's so beautiful, Claritza. Just that piece about, just the changes that happen, right? Like how your skin feels different after chemo, and navigating that. And again, going back to grief, not to always bring grief into it, but like, shit, that's like, you just lost the way that you relate to the world. And so everybody's on new landscape. It's like you just got catapulted onto another planet, right? And yet you're in the same dynamic, but you're in a different world.
100%. And the partner, there's grief for the partner as well, right?
Totally.
These two folks were like, they knew the way they touch each other. This is leading to something, and that changed, and there was restraint and hesitation, thank God for their ability to get back together and communicate about what was needed. And they were able to find this new way, but it was still under that beautiful foundation they had of years and years of being together.
Yeah, yeah, that communication. So what you said, Claritza, like just understanding the difference. Like even if you're with a partner, like you said, for maybe 30 years, you might have different definitions of what is sensual and what is sensuous, right? And sensual tends to lead to sexual. Sensuous is not inherently sexual. Sensuous is pleasure through the senses. And you could be living with somebody for a really long time and never know that you're each having really different experiences around that, or that now you're longing for a different experience with that. And there's a way to bring in partners into your longing. Just because a longing changes doesn't mean somebody has been left out or no longer fits in. There's a way to actually invite someone into a shift of awareness with you. And that's a beautiful invitation that can feel tender and like, who is this person? Where are they going? I didn't know they wanted to go in that direction versus, okay, I'll come with you. I have no idea where you're going. It's scaring me a little bit. I'm not sure that I can go, but I'd like to try, right? And so that's the
Absolutely.
tenderness of grace around knowing what you're willing to do. And honestly, this, we haven't brought this in yet, but you know, there are difficult decisions in here as well, which is you don't feel it. You realize that the illness has actually changed your dynamic in the relationship, and it is now so pragmatic, and that place, you're not finding that ground anymore. And for some people, it isn't going to return, and it doesn't have to return. And so then what does that mean? How do you
Right.
tend to that gloss and that grief and that realization and being truthful about it?
Right.
It's another whole conversation.
But I think it's beautiful to bring that up because we assume that that's it. There's a change. And the reality is that maybe for many people, that's it. That just may be the way it is. But for many people, there's an in between, there's an opportunity. As you said, I love the word invitation to look for new things. And so much of being a partner with someone is, at least I'm going to get personal, but for me, is knowing that I'm bringing pleasure and joy to my partner, right? And that I am respite, that I am escape, right? That may not, for many people, that may not always be sexual. And so, how do we bring the sensuous? Can I be a vehicle of getting you to that, the touching the grass, the going to look at the sunset? And how do we make that a beautiful bonding experience where we're both reveling in that pleasure?
Yeah, and I
There's
would
an
say
opportunity there.
unspoken times together. I mean, this maybe more than ever with illness, you know, for anyone that's been in partnership for a long time, and plenty of people haven't, but it's akin to what you experience with a pet or in nature, which is experiencing pleasure without speaking, right? Just being in the same room. So allowing actually the fact that your partner is in the other room reading a book and you happen to be in the kitchen, that can be a beautiful place of connection in because you're in the same space. So expanding our capacity to appreciate proximity versus thinking that it needs to just be in these certain packages, right? And like hearing, like for me, I can, it's going personal like you were, Clarice. Like when I remember when I was married and just knowing, like hearing that person was so intimate to me, to hear them in the house, that felt very intimate to me. It felt like we were sharing, even though we were just doing random chores in the house, right? So opening up our capacities to experience the world. And I think for times of illness, when our bodies change, we forget a little bit of how we experience the world. And so intimacy allows us to open back up, right? When we're intimate, we're open. Someone is coming in, and allowing somebody in means that we're allowing other things in as well. So you can start with letting in the world, letting in the sun, letting in the rain, letting in sounds, music. You don't have to start at the hardest or the thing that maybe seems the farthest away, or the thing that feels maybe you've lost the most contact to.
Mm-hmm. Love that. One of the things that we can't go without talking about is uncomfortable conversations. And for many people, they're not. They're just important conversations to be had about symptoms and things like, hey, my libido, or hey, this happens. But we felt important that often we don't. They are uncomfortable, and so things don't come up, and we make assumptions. And if I've learned anything about being a physician for more than 20 years, it's assume nothing. And so it's really important in anything in life. And so having engaging in in tough conversations is important. And as we were prepping for this, I was thinking, that it's really important for folks who are on this call to walk away with the understanding that you are allowed, have permission, and should engage your providers, your medical providers, your team who's if you're caring for someone with an illness, or if you're the person with the illness, to ask questions of your provider and to feel empowered to do that. As Ladybird said earlier, so much of what we end up doing in medicine is siloing things, right? So it's the tumor in your abdomen, the injury in your spinal cord. And this is happening to a whole person who has a role in their family, in their society, in their relationship, with themselves. And so we want you to feel really empowered to ask questions like, hey, is this normal? I've had patients say to me, I am experiencing pain with intercourse now that I'm on chemotherapy. What's that about? Or my libido is no longer the way it used to be. Or is this a normal side effect of a medication? Not just so that then we can help mitigate that, but I think it's important that you're not just getting information, but you're getting validation. Again, because we are supposed to fill all these like societal roles and be a certain way. Illness does not always allow us to do that. While we're trying to evolve and become less like that, it's important to get validation that yes, these things are normal, or that side effect is expected, but this is how we can mitigate it. This is how we can help you feel better. This is what we can do to make sure that sex isn't painful, or that, what can we do to help with your libido? Ask your provider. And if they don't have an answer, cool, no problem. Where can I find resources? Is there somebody else we can ask? Is there somebody in your practice? Are there support groups for people going through the treatment that I'm going through, where I can ask these questions without putting too much burden on the sick person who already has a lot on their plate? But I think it's really important for people to feel comfortable asking those questions. And then on the flip side of that, when we're talking to partners, whether you're the sick person speaking to the partner, or the person with a condition speaking to the partner, or the caregiver or a partner of someone who's dealing with an illness, is just call things out. And again, I'm going back to communication. I think that that's so incredibly important to say things like, hey, I have really strong feelings about my appearance, and I am going to have really a tough time being naked in front of you. Or I have an attachment to my nose, and now my nose is getting cut off, and that's going to give me feelings about us being intimate, or not, or hey, these are my expectations. How do you feel about this? It's important to talk that through. And I wonder, Ladybird, any thoughts on like how to tackle a conversation like that with a partner? Do you have any thoughts on that?
Yeah, I mean, I guess it's really just, it's courageousness, and I don't know that there's any one way to do it. I think you just get to a point where you feel so uncomfortable not having it, and you want to be seen and held more than you don't. That usually pushes those conversations to happen, and we don't always know how to show up for them. I mean, they're tender conversations, and the more we do them, the more familiar they can become. But I would just say that they're just not easy, and that both sides of it have some fragility and vulnerability around how we respond and show up for these things. And it starts at the beginning, like, again, starting in the medical room, like when you, like, let's just talk about, like, if you're having a mastectomy and these conversations around everything changes, just your appearance, the way that you feel as a woman. There's so much happening, that there's so many layers to be aware of, and to just hold each one really kindly and gently, and to trust that you will find a way to relate in the world again, if that's something that you're really ready to do. And so you start to find the people that you can do that with. It might not be your medical provider. That might be the worst person to have that
Yeah.
conversation with, right? So this doesn't mean that share everything with your medical provider. You might realize,
Right.
not going there, I need to find somebody else. And because of the internet and because of how things are now, these support groups, talking to other people who have gone through similar experiences. How did you navigate sexuality? How did you get through that conversation with your partners? Talk to people who've done it. I
Right.
think is probably more helpful than necessarily expecting a partner to know how to do that with you. So that
Right.
grace again that you were mentioning, it's messy, it's uncomfortable, there's tears, there's fear, there's grief. It's all there, hopefully, and that's what you get to have in the fullness of human experience. So in some ways, if you can, welcome the discomfort even as you're upset by it, right?
Yeah. I like that. And I think what I would hope is that that the fear doesn't keep you from exploring, from like asking, from being curious. And so allow yourself to grieve. Do it scared, as they say, but do it in the right venue, right? Find the right person and get the tools. Absolutely.
And then allow yourself to play again, right? And I can't see what time it is. I don't know if Sonia, if you want to have time for questions, but
Yeah,
allow
we've
yourself
got
to play. We've been kind of harsh. I mean, this has been, it's every time it's a little bit of a different twist, but there's a lot of play. There's a lot of joy. There's a lot of laughter in the sensual world, the sensuous world. And so remembering that those are also welcome and invited. This isn't just about, oh, we got to be really serious and figure out how to have sex again. That's not what we're trying to get at, hopefully.
Right.
Yeah, we've got a couple of minutes here. Anyone who's got a question, please feel free to raise your hand or type it in. Ladybird, if you want to just stop sharing your screen. There you go. Lovely. Okay. We have a hand up. That's Karen. 1 second. Karen, you may have to unmute yourself on your end, but you're set for here. There you are.
Got it unmuted. Thank you, Sonia. And thank you, Ladybird and Claritza. I'm just weighing in because sexuality, my husband, Steve, and I, 2 years ago, I'm entering year 3 of treatment on diagnosis of lung cancer. My first reaction was, I am so heartbroken for my body. And then the incredible chaos with getting staged, getting a treatment plan put together, chemotherapy, radiation, and it's quite an assault on the body, excuse me, and routines just get yanked away. And the courageous conversations didn't happen for several months, but certainly with my husband and me, we knew we had a loss. Our lovemaking was just gone. And then from a medical standpoint, really having to be educated that chemotherapy drugs in my body are toxic, that there is a danger, so to speak, in lovemaking, even flushing a toilet twice with the lid down. These very unromantic considerations. But to come back to how we got lovemaking back, and it is kind of tricky to talk about it, but I really needed a hard conversation with oncology. And I'm so fortunate that I got it because so much healing comes from intimacy. And it's certainly true. There are so many ways to be intimate, but the loss that disease causes, to build it back. I did need to figure out, I think Kate Bowler says, you are not the bad thing, to kind of get over that. As damaged as I felt for my body, I still was intact. I still could be a partner. I still could appreciate aesthetics and beautiful things. And I'm just going to put in a plug for an early referral for palliative care, because that now is where intimacy tends to be lifted up, if you will. And it's not because oncology can't do it. They are so busy, so that in the kind of overall scheme of things, my care team was really important. But I did have to be the one to have the self-awareness. I am curating my life. I've lost so many things. What can I claw back from cancer? What do I really want back? What do I need back? As my voice gives out here. So just, I'm very grateful for this conversation. And I think it is hard to talk about it. But there are ways to do it. And the yearning and the longing that I think you both spoke to, there is a tenderness, and in fulfilling those yearnings, healing happens. It really does. And lovemaking and sensuality is part of that. It's part of the beauty of being fully human. And with that, just thank you so much. Thank you both.
Wow, Karen, thank you so much for speaking. You said a world of, you just gave us a universe of
So many,
oh my
so many
gosh,
pearls, right?
so many pearls, but just so much truth and
Yeah.
tenderness and courage. And thank you for sharing that with us, with the group.
Yeah, it's really beautiful. And I love, I think it's so great to hear your story, because you advocated for yourself. And it's not easy, right? But you found kind of what made sense for you. And as a palliative care doctor, I appreciate the plug for palliative care. And I appreciate you saying that oncologists don't have a lot of time, but I also, it sounds to me like you said, you don't have a lot of time, but I have this need, and you found your team, and that's wonderful. But that's a credit to you, Karen, to just, navigate that. That's really, really fantastic. Thank you so much. Beautiful.
It was so late. Oh my gosh, I'm sorry we spoke so long.
No, don't. No
Oh my
apologies. Everything
goodness.
you guys shared was lovely. And yes, thank you. I'll just echo a lot of people in the chat. Thank you, Karen, for sharing. I think that helps. It's such a hard thing to talk about in our culture. So appreciate you doing that. Let's see. If you guys have a couple more seconds, we do. Anyone else has another question or anything? We can also, of course, leave it with your fabulous comments and Karen's fabulous comments.
I think I want to just speak to Marceline.
Please, yeah.
Marceline, I hope I'm saying your name right. Again, just your comment about your experience with temporal lobe epilepsy and your partner's spinal cord injury. And this might be coming out of left field, but sort of on the heels of what Karen shared, that finding that courage to just I don't know, there's something about, I feel like breathing together, especially when you've gone through such a traumatic shift in everything and you're both in places that are so different, to just go back to the basics first. Give yourself that grace to go back to the basics of hand on hand, breathing together. And, Karen was saying, these inroads to sexual intimacy, but trusting in the power of breath is something that I just wanted to share, because we kind of don't use it enough. Now she's got her hand raised. Good.
Yay.
Sonia, can we?
Yeah. Let's see.
Hi, thank
there
you.
you are. Hi.
That's yes. In fact, it made me think briefly, Ladybird, about how doing his wound care every morning, how that is an intimate thing, but sometimes I see it as a stressful thing. but it is, you know, it's touch. And so thank you so much. What you said really resonated with me. Thank you so much.
Welcome. And I'm sorry it sounds really hard, and maybe finding other ways, like let wound care be wound care. That is
Right.
tough. I'm even as a nurse, wound care is tough.
Yeah.
Doing that on a loved one is incredibly hard. And find a time to just touch his ear,
Yes.
touch his
Yeah.
eyebrow, you know, touch,
Yes.
just sit next to each other and watch a movie, and let the intimacy find you both.
Yeah.
Sometimes that is helpful.
Yeah. And
Thank you so much.
I'll just add to that. First, thank you for being so brave and sharing this with us. And also engaging with him on what I'm hearing from you is also this desire to make sure he's in a good place and you're in a good place, and sort of like, yeah, wound care will be wound care. Yeah, touch is important, but maybe we need to separate it. But what would feel good, you know? Can I massage your neck? Can I, you know, just take a feather and run it down your back? These things
Yes.
that can feel really, really silly and fun, but take you from the place of just being caregiver, and also allow him to feel that you're engaging in that sort of sensual, maybe will lead to sexual, but certainly sensual and intimate place. And kudos to you for just being there in that way, and exploring that, because there's a lot on your plate, and it sounds like you're really mindful of that for him. So just want to call that out.
Thank you, Claritza. Thank you.
Thanks everyone again for sharing your experiences here. I want to be mindful of time, so if it sounds good to everyone, I will say good afternoon. And thank you so much, Ladybird, Claritza, for being here. Thanks everyone else for attending and listening with us. We really appreciate it and hope you have a restful weekend.
Blessings,
Bye,
blessings.
everybody.
Courage
Thank
and
you.
curiosity.
Thank you.
Courage
Bye.
and curiosity.
Thank you.